The human soul is desperate for wholesomeness in a relationship, and it's getting harder and harder to find.
In part one of Myths About Narcissism, I sat down with Dr. George Simon and Dr. Peter Salerno to break down 5 of what I consider to be 5 of the most dangerous myths that people still have about narcissism. And I don't just mean social media theories and pop culture theories, but I think really the kind of myths and beliefs that keep survivors stuck and confused and blaming themselves. And it's really difficult because I think that these are also the kind of myths that have shaped how therapists and clinicians study this and talk about this and offer support to survivors. And really the kind of myths that could even give some abusive people a get out of jail free card. And we talked about the idea in part 1 that everybody's a little narcissistic, or the myth that narcissists are just insecure or secretly full of shame, the belief that they are mentally ill, and the one that kind of gets me called every name in the book, that narcissism is caused solely by childhood trauma. And the truth is, they're not broken people lashing out because they hate themselves, and they're not stuck in a trauma loop that just makes them abuse. I think we need to see them as adults making choices, and they know what they're doing. And in some cases, they like it. It's not trauma that causes narcissism. There's research that shows that there's heritable traits, meaning that there's some genetics involved in this. So I really want to encourage people to go back and watch part 1 to get the full scope. In this episode, we're going to go a little bit deeper. We're going to go into 5 more myths that might sound reasonable on the surface, but I think are really just as harmful. And the last one is probably the most repeated myth of all. And I think it's one of the most invalidating things that survivors are told. So please stick around for that. Now, once again, I have brought in Dr. Simon and Dr. Salerno to break this down. Clinicians, authors, and researchers, and not just with theory, right, but with truth that survivors can actually use. So first, I'll quickly introduce myself, and then I'll turn it over to these gentlemen. So my name is Lisa Sonni, and I am a certified relationship coach. I help women break free from toxic and abusive relationships. And I have 7 certifications. I wrote 4 books, and I speak internationally on the topic of trauma bonds and narcissistic abuse and recovery from these kinds of relationships. Now, Dr. Simon, I know that you've been doing this work for decades, and I want to give people a sense really of why they should listen to you, because you're not just sharing opinions, right? You're challenging things that most therapists and most people believe about narcissism. So I think before we dive in, I'm going to invite you to just talk a little bit about what qualifies you, and then I'll throw that same question over to Dr. Salerno.
Oh, my goodness. Well, what qualifies me is over 45 years of clinical and other research. And in the early days, I have to say that I was up against quite an establishment. For one thing, the folks that decide what's an official disorder in the medical community were debating very seriously whether there was any such thing as a personality or a character disorder way back when I got started. And they didn't take very well to some of the research that I was doing or some of the things that I was saying. Everything at the time they wanted to see in terms of biochemistry, of chemical imbalances that could be taken care of with medicine. And they also wanted to see certain clinical conditions at the root. Basically, what we were thinking was character-related matters, or what we were thinking was a personality style choice. They didn't believe in that at the time and thought, for example, that when they witnessed the grandiosity associated with a person with a narcissistic personality disorder, they thought that that was maybe a mild form of mania, and that just the right mood stabilizing medicine, when we found it, would just take care of that. So back when I got started, things were just as contentious as they've continued to be for some folks. But we now know that personality disorders are real, that they are by definition almost impossible to treat by traditional methods because they're inherently resistant to modification. That's what defines the disorder. The person likes the way they see things, they like the way they do things, And many times, because it's worked so well for them, or at least they believe it has, and maybe they even have something to show for that, they have virtually no incentive to change it. So, that became clear to me years ago. It's becoming clearer to other folks now. I feel some sense of validation, but really the validation I want to say means the most to me is the validation from people who I wrote to in my books. I wrote all the books for them, and the validation, I just can't tell you over the number of years how many emails and letters and whatnot that I've gotten from folks saying, oh my goodness, somebody finally validates what I knew in my heart or I knew in my gut forever and couldn't get anybody to understand. And that helped them overcome this feeling crazy effect that we call gaslighting. And they felt validated for the first time. That's the reward that I really can't say enough about. I feel plenty validated these days. So
sadly, right? I think I wish that there was more information out there, which ultimately is what led me to even have this conversation. I wish that more people could be validated by that. So I always link all of your books, both of you, in the description so that people can access that because it is so validating. I remember reading your book, Dr. Simon, and just being like, oh my God, someone gets it. This is amazing. And I felt the exact same way when I read Peter's. It's just so necessary. So thank you both so much for your work.
Well, thank you.
Dr. Salerno, can you kind of introduce yourself and say, what qualifies you to speak about this? And then I'll get into the very first myth.
Sure. So I obviously have the educational background as Dr. Simon has. We both have doctorates in psychology, which is no easy feat. I kind of still look at the formal education as the starting point, not anywhere close to the end, but your mind is shaped in almost a decade of study and being a student of this. So that certainly lends itself. But following formal education and licensure, I made it a point to particularly specialize in two fields, if you will. One is people who are recovering from trauma-related conditions, and oftentimes trauma inflicted in interpersonal relationships with people who likely one partner is a personality or character disordered. And then I also specialized in treating those individuals themselves. And in fact, I was a student of Dr. Simon. He was one of my mentors in that because I attended his trainings. So, I guess there's a difference between sort of just like in medicine, being a general practitioner and a specialist. And the specialist is somebody who dedicates, all of their time and study on, something in particular. And so working with these people in clinical settings, researching, and then working with, victims and survivors of the relationships with these individuals, I think really lends itself. I think, I guess the term expertise is relative and it means different things to different people. But if you go through the appropriate channels and then dedicate your entire career and your continuing education to a particular emphasis, I'd say, and you have success in treating and understanding and you receive the validation, then I think that constitutes some level of specialty or, trust in that person's perspective. And I will even say I'm one of the individuals who emailed Dr. Simon, thanked him for his work because not just professionally, but personally, it got me out of a pretty big bind. So, that's more validation that he's certainly worth his weight.
Right. Now, the reason I even sort of frame the question as that is because I'm just a coach and I'm not being self-deprecating, but I don't treat these people. I don't research these people and these personality types, these character disturbances. So I am by no means an expert in how it is formed and where it comes from, and that I help women heal from these types of relationships. But in this field, I see so many myths and I get comments after comment after comment, just invalidating the experience of people. So it has led me to sort of put this together. Part 1, we covered those 5 myths. Part 2, we're covering 5 more. And so the first one is sort of this split behavior myth. They can play both sides. They're good and bad. So if their behavior is fine around other people, then they can't be a narcissist because narcissists are all bad. What's your take on that? Why don't we start with Dr. Simon?
Well, unfortunately, these folks, if someone is truly a narcissist, they have the capacity many times to present a very positive face. Sometimes they can be quite charming. Sometimes they can even have some degree of charisma. As a matter of fact, confidence itself, even if it's overconfidence and even if it's masked grandiosity, sometimes can be quite infectious. You want to think somebody is really capable or knows what they're talking about. So if the person has developed the skills of some degree of charm, they know how to flatter, they know how to use certain tactics that I describe in my book that endear people naturally. They've learned, so shall we say, the tricks of the trade of being a charmer. They can present a wonderful image. That doesn't make them a good person. So many folks have written to ask me, well, isn't it necessarily true that someone who's got all these social skills must have some degree of character? No. Some of these behaviors are strictly tactical. Some narcissistic individuals are great reads of people. They kind of they size up the room they're in, they size up who they're dealing with quite intuitively, and they know just how to play it. And one example that I can think of that made headlines a while back was that horrible abusive case of Gabby Petito and her boyfriend, Brian Laundrie. They were actually stopped by the police, and not only did this person present himself, he knew just how to behave, just what to do in the presence of the authorities, how to present a benign image, and was so effective at it and so convincing at it that the victim, in this case, presented herself as the problem. This is not uncommon. And so everyone is deceived. That doesn't mean that they're capable, really, of decent behavior. It just means that they know how to manipulate.
But that's so powerful. I think the fact that they can split their behavior, I don't know how that proves that they're not narcissists. I feel like I would argue it's the opposite. They know when to play it. I always say to people, if he's not screaming at you at the grocery store, it's always behind closed doors. That actually demonstrates an ability to know when to turn it on and off based on who's looking, which speaks to their image management.
And there are some behaviors, I hope we get to this later in the discussion. There are some behaviors that are much more telltale, but you got to know what to look for. In the workshops, I discuss this, but there are some things that are a more reliable indicator of who someone really is.
Let's get to that. I think that would be an amazing wrap up, actually. And what do we look for? Because that's all. We're going to talk about the misinformation. Let's talk about what it actually is. But on that note, Dr. Salerno, what do you have to say about that sort of split behavior?
I know from clinical experience that some of that split behavior is absolutely conscious and deliberate, right? There's an element of, Dr. Simon mentioned tactics. This is very strategic at times because I think even, we can get into the discussion briefly about the difference between what's a defense mechanism or a reaction to threat and then something that's more offensive and intentional, right? It's choreographed or premeditated. I think these individuals practice these strategies, and when they get the results they want, they keep repeating them until, as Dr. Simon says, what was conscious and deliberate can become automatic and habitual. But I really don't see these shifts as like a split personality or something kind of silly like that, where they're forgetting who they were and they're just being different in a sort of reactive sense. I think that they know how to ingratiate and win favor depending on the audience. The audience is sometimes private, and even that vacillates between overt and covert manipulation. And then when the audience is more public, they have a way of kind of saving face. I mean, they are exercising a lot of maintenance of this image and impression management. So I would say it's much more conscious and deliberate, and they're aware how purposeful it is. I think more than people would think.
Yeah, more than people would care to admit. I think the knowledge that they can turn that on and off, it's like, wait a minute, you mean that they know and they're doing this on purpose? It's really heavy. So I completely get why people struggle with that. Kind of perfect segue actually into our second myth, which is that narcissists don't know that they're narcissists. And maybe that's true in terms of the label, but let's kind of let go of that. Do narcissists know that their behavior is bad? Do they understand that how they show up in the world is not well received Dr. Simon?
Well, they know when folks have an issue with them or a problem with how they've been treated by them. They know that. It's probably happened dozens, if not hundreds or thousands of times that somebody has given them that kind of feedback when they haven't turned on the charm, when they're not trying to impress, when they're not trying to seduce or manipulate another way. They're just being their own callous, entitled, selfish, exploitative self. They've gotten feedback about that. They don't care. They don't care. So they're very aware. They just don't care.
I mean, I love the simplicity of your answer. And it's actually, I'm recalling a comment that I saw on social media on one of my pages. In fact, it might have been on the YouTube video from the first video that we made. But it was like, no. My abuser is oblivious to the fact that he hurts me. He's constantly telling me that he doesn't understand why I'm so angry and why I get so upset. And I sit here and I think, well, he's convinced you of that he's oblivious. But I don't believe that that's true. I think that's the evidence right there. Dr. Salerno, what do you think? What would you say to a comment like that or to someone saying that to you?
I mean, a case-by-case basis, it's hard without all the details because there are other, comorbid or co-occurring things that could potentially explain that depending on a formal assessment. But there's also the reality that these people just lie about not knowing what they're doing or why it's a problem. Again, Dr. Simon says it's not that they don't see, it's really they just disagree that they're the problem. I mean, they're consciously aware they're creating problems in people's lives. And so they're also, as skilled as they are at charming, they're skilled at denying and convincing that they're not doing something or they're not aware or it wasn't intentional. To a degree, I think we could argue they don't see their insensitivity as meanness, but they also are aware it's producing negative consequences and they're not going to find that as originating in them.
Mm-hmm.
Right.
I remember you said this. I'm going to quote you to you, Salerno. You said in an interview that you and I did months ago that the only problem that, as they see it, is that you keep talking about this problem. If you would just stop talking, the problem would go away. That's their perception of it. So it's so true, I feel like, that they recognize that you think it's a problem and they recognize that people don't like their behavior, but they are not compelled to change.
Yeah.
Is that accurate?
Yeah.
From both of you? Yes?
I'd like to add something about that because that's a really important dynamic that occurs so frequently in abusive relationships of one type or another. One of the things that is dynamically, I believe, at the core of narcissistic dysfunction is this abhorrence of the notion of capitulation, some degree of surrender, some degree of subordination to anything bigger or more important than what I want. So even if a person can't fully see just exactly why, all the reasons why someone is upset, they probably know that every time they behave this certain way, the person gets upset, right? Now they're faced with a decision to make. Do I accept that this behavior makes the person hurt? And do I care enough to modify my behavior because they hurt every time I do this? Those two dynamics, caring enough about the hurt that I witness that I cause, and here's the big one, will I subordinate myself to the work that it would take to change my way? That's the core dilemma for any character disturbance, especially narcissism.
That's, to me, so clear, and I've lived it. So I certainly, in hindsight, felt that way. Although I do very vividly remember what it's like to be like, no, but you don't understand, to the people who see it from the outside. But when you're in it, I don't know, you're blind to it. From the survivor's perspective, you're blind to it when you're in it. But what you're kind of talking about is their ability to change, which is myth number 3, right? Narcissists can't help their behavior. They can't help being abusive. It's not their fault. It's just the way that they're wired. Let's talk a little bit about that. And Dr. Salerno, why don't you start? What's your take on they can't help their behavior?
Well, even, let's say, predispositions or learned behaviors, there's a sense of choice that needs to be, actualized there. It's not just that these people are running around completely unconscious and reactive and they're just going about things because they are wired in a reactive way. It's not that simple. I think a lot of people think that everything is a defense, and that's the problem. So intentionality here and benefiting from the way they are. because it's producing the outcome or the results they want.
All right. Dr. Simon?
I'm going to go to one of the pioneers in the field on that topic. Stanton Samanow and Irvin Yackelson, years and years and years ago, started pioneering research as they worked with this criminal population and with other populations that displayed the kinds of attitudes and whatnot that we now include under the umbrella of narcissism. And he was very careful with words. Cannot, what seems like cannot, most of the time is care not. Okay? It's not that the potential isn't there to change. It's that the motivation is not there to change so many times. Now, sometimes circumstances can get so bad, sometimes just the right mix of environmental pressures can increase to some degree someone's motivation to make a change. But that pressure is all external. What can happen, I want to emphasize, it's extremely rare, is where the pressure is internal, where someone, for some reason, mostly internal, becomes dissatisfied with what has always seemed to work for them. That's extremely rare. So most of the time, just the right factors have to be there, external pressure, and then how deep the change really is, you might never know. Because if all the factors influencing have to do with pressure from the outside, you just never really know how that's going to turn out. But we have to be careful with our terms. And I'll just remember what Dr. Samanow said years ago. Most of the time, cannot is really care not.
Again, love the simplicity of that, because it's so hard when you're in it thinking like, well, he can't help it or she can't help it. This is just, they're trying, but, and I feel like that version of what we think they're trying, it's their words, they're saying, but this is hard for me. And I always think, cutting through some of the crap, it's like, is it really that hard for you to be a nice, decent human being? Because if they can't help it, then this is forever, right? You're in this relationship with someone. This is something that is just going to be ongoing. We as survivors have to kind of decide, can I handle this? Should I handle this? Do I want to handle this?
If I might, once again, return to that core dynamic. This is so important. Yes, it's difficult. Yeah, it's difficult. So having the heart to take on that burden, to have the heart to subordinate oneself, one's mind, one's will, one's heart to something bigger outside of my own sweet, selfish desires requires work. And you have to have a heart for it. That's the key variable. And no amount of external pressure can create that heart. So,
agreed.
Can they? Of course they can. Do they care to? Rarely.
Right. Close to never. People always ask me that, actually, like, how often do you see them change? I'm not the right person to ask that because I don't work with that group of people. From my chair, I'm working with the survivors. The answer is never. However, fourth myth is that they can change with the right support. And I personally have, I say studied this loosely, like Googled and read blogs and articles and books on the topic of, can they change? And I will say, in my opinion, we sort of seek out these black and white answers. Yes, they can change. No, they can't change. And I think that this is a gray area. But I think when we talk about they can't change, you get sort of accused of demonizing this disorder, or like, what does it look like if they're changing? Is it cured? Is it changed behavior? This is a big question, I realize, and it's not even the big final myth that we're going to cover, but what's your take on, can they change?
Yeah, well, again, not agreeing that how they are is a problem, doesn't motivate change. But that, again, that's different than the capacity to modify something through, practice and exercise and things like that. I think that there are interventions and tools that can assist people if they're collaborative enough and motivated enough to affect some change. But again, we see change, like we see these disorders, often we refer to them as ego syntonic. Everything is sort of in harmony inside. They're not having, let's say, the right kinds of consequences, and they're not seeing these problematic issues as originating in themselves. It's only in response to something out there, someone out there. So because this works for them, the motivation to change is probably more an important thing to consider than the capacity.
I say that sometimes, it's not, I don't know if it's a matter of can they change, it's a matter of will they? Because change starts with a choice. And I don't mean to oversimplify that, like they can just choose to be completely different, but it starts with the choice. And I think if that's missing, what could possibly be next doesn't happen. Now, I know that they pretend to change. And again, I think that's motivated by their need for control and to keep the person with them for the purposes of control, not because they love the person. But Dr. Simon, what's your take on that? I know it's not an easy question, but can they change?
Well, two things. One, it depends on where they are on the character disturbance spectrum. Not every single thing that's diagnosed is of the same intensity or the same degree of being ingrained or intractable. So that's one thing that the clinician has to assess. But this myth about the right support. Folks who need support are folks that are really trying, but need some assistance. Okay? Folks who aren't trying, who have been dragged from office to office, from therapy encounter to therapy encounter, and nothing is changing, and they have no motivation to change, don't need support. They need something entirely different. Here's what often happens, however, in traditional settings. The very same ingrained, pervasive, like Dr. Salerno said, egocentric, I'm very comfortable with it. This is the way I've always done it. This is the way I'm going to continue to do it. The very same behavior that's a problem usually shows up in the therapist's office. And if it's not dealt with appropriately, two things happen. The person with the disorder is reinforced for doing their horrible stuff all over again, and the victim is traumatized all over again in the therapy office because just what they came in to hope gets addressed happens again. And if the therapist doesn't see it or doesn't intervene appropriately to correct it, more trauma happens. And Dr. Salerno works with trauma, so he knows, I think, exactly what I'm talking about here.
Yeah, it's that belief that they can change or do better, the belief that this is just a choice. I mean, I do fundamentally believe that abuse is a choice, but they could just choose to do something different. There's so many factors.
Yeah, and if I can add just one thing real quick that I meant to say but forgot. As I say in my workshops, if change is going to happen, it's going to happen right here and right now. That's where it's going to happen. If somebody's going to show more respect to their partner and more appreciation for their partner's feelings, they're going to do that right here and right now. And if they're not going to do that, you're going to see that also right here and right now. Yeah.
I see a lot of, well, I'll go to therapy. Okay, I'll try. And
Yeah.
when I first sort of started in this, which was only 5 years ago, I hear a lot of, narcissists never go to therapy. I don't really like that black and white language of all narcissists, whatever, or they all refuse therapy. I think plenty will go to therapy. Will they get something out of it? Are they there for genuine reasons? And in defense of all therapists, you are working with what's in front of you. If a person is telling you that they're trying, you kind of have to give them the benefit of the doubt, unless you're a specialist in this perhaps, and you might see through it. But survivors latch on to that. But I want to change. So maybe sort of a sub-question of this myth is, what does that look like? What does actual change look like? You're describing like they're taking ownership of it right now. So if they're sort of, I'll go, but they don't, or they go, but you're not seeing change, is that a big sign for you that this isn't real?
It's not only a big sign that it's not real, I have to question the value of even proceeding. And many times, as Dr. Salerno knows from my workshops, many times I deny service as a strategic and therapeutic thing to do for someone who's just plain not ready to work. And that is actually one of the most therapeutic things a clinician can do, is to say, okay, I respect you're really not ready right here, right now, to do the work necessary to change. Okay, I can't force you. I can't change your heart, but I'm here.
It probably allows you to help people who really want the help.
Yeah.
Yeah, right. Dr. Slater, do you have anything to add to that?
Yeah, I just want to add, like, even if we're talking about some degree of measurable change or progress, maybe somebody stops doing something as often or whatever, we also have to wonder about the sincerity, because even if there's some jumping through a few hoops, whether it's feigned collaboration or maybe they have a tiny little sense that this might work in their best self-interest to be a bit different. The emotional sensitivity and the emotional understanding of why this is important to someone could be still absent. So there's the sincerity that won't accompany some of this self-correction, let's say. And so it's not like the dynamic becomes all of a sudden much more pleasant or fulfilling. Oftentimes, that's an indicator that, that lack of sincerity is kind of like something that's going to have to be settled for. So I just kind of wanted to add that too, even if we're talking about changing behavior or correction, that lack of sincerity might not make it as meaningful in some situations.
Yeah, I agree. I think that was a really good thing to add. That's an important point. I don't see a lot of change. I see a lot of promises of change, but I think that the action is something that you would see both in them making their own appointments and going and talking about what they're learning and talking about, I just learned about gaslighting and I'm bringing that back to you. And you're right, I do that. And if you don't see that and feel that, I think there's a big miss in whether or not the change is actually happening. I get holding on to that hope, but hope is brutal when you're holding on to it in these relationships. That's one of the many things that I work with people on to sort of sever that hope and kind of destroy the fantasy and look at things from the perspective of reality, which is very hard when you're in it, no doubt. So our last big myth, which I'm not going to pretend isn't the most irritating one that I hear, but I think it is the most invalidating one. And I imagine you've both heard it, but can speak to it so much better than I can, which is that narcissism is completely overused because only 1% of the population is an actual narcissist. So this is the one that I really want to kind of dig into, because I think that there's a lot to be said here that perhaps that statistic is true in the sense of that is what has been diagnosed, but what does that actually mean? How do we sort of factor in what we know about narcissists is that they don't think there's anything wrong with them, so why would they change? So can we talk about, overdiagnosis or underdiagnosis, whether or not people are overusing the word, the diagnosis versus the traits, all of that? Dr. Simon, why don't you start?
Okay.
Big question.
This is a very sensitive topic for me because I had the great privilege in my training to be a student of someone who was the student of the most preeminent researcher in the field of personality. And my subspecialty for all these years has been a study of the moral/ethical dimension of personality that we call character. And as you know, one of my books is entitled Character Disturbance. I do believe that character disturbance of one type or another or one degree or of another is the phenomenon of our age. There is, unfortunately, an epidemic of character dysfunction of one type or another or one degree of another in modern culture. A vicious circle has been churning for several decades, whereas character fostering norms, institutions, expectations in the society, all designed to help mold and shape good character in people. As those things eroded, more and more character disturbance appeared on the scene. And as more and more impaired characters populated the society, those institutions and norms and standards, expectations, etc., deteriorated even further. And then as they deteriorated even further, more character disturbance, and more character disturbance, more erosion of things. It's been a vicious cycle going on now for several decades. And so behavior that was once considered extremely unusual or outrageous, would be universally condemned, would not be tolerated, has become almost the new normal. So maybe narcissism has become the diagnosis du jour. We tend to do that in the field. There are many character disturbances that have narcissism as their primary feature. And yes, there are folks with narcissistic traits that don't qualify for the official diagnosis of narcissistic personality disorder. But character disturbance of one type or another has become far too normalized. And it's why people of decent character are having so much trouble finding wholesomeness in their relationships. The human soul is desperate for wholesomeness in a relationship. and it's getting harder and harder to find. And that's a sad commentary. We used to understand more universally what it took, what kind of cooperation, there's an old saying, it takes a village, what it took in the way of norms, standards, expectations, what it took in the way of cooperation between educators, parents, leaders, what it took to help instill and motivate and to encourage and reward character. And we also seem to understand, that's why I wrote the book, Essentials for the Journey, the 10 Commandments of Character, what values, what standards had to be internalized in a person to help make them a decent sort, or at least a relatively decent sort, regardless of their genetically conferred or biologically conferred tendencies. We seem to have lost our way on that. And I pray things have a way of turning around, that we move too far in one direction and then there is kind of an inherent pressure to move back the other way. I pray that we rediscover the supreme importance of character and also rediscover all that it takes to help shape it, mold it, encourage it, and reinforce it, especially reinforce it. Because right now, unfortunately, all manner of unwholesomeness is not only rewarded, it works. It's the new normal. And we can't endure much more of that.
What a completely powerful point. I think it is seemingly so accepted in the world and rewarded, more than accepted, in fact. So I've always felt like, I don't know if underdiagnosed is the right word, but I definitely think it's more than 1%. I would hang my hat on that. Absolutely. And I also think that the diagnosis itself is not that important, because I think that the traits and what makes this character who they are matters so much more. Yeah, what an amazing point. Dr. Salerno, what about you? What do you sort of make of this? It's only 1% stat.
I think 1% is very misleading. And, if we're really just going on prevalence estimates, that it's kind of depending on who you're talking to and how it's being interpreted. But the reality is, if we're just looking clinically, NPD is one of a few disorders where these, we'll call them narcissistic traits, are prevalent. So even if somebody doesn't meet the criteria, let's say, for that one disorder, there are a lot of other people walking around with similar features, even if it's just one or two less traits or a little bit less severity, right? We're talking about a large population of people that have these traits that I would say kind of operate on the more extreme of the continuum, or the deficient. And so I just think it's very misleading to take this 1%. I believe the 1% is supposed to be referring to people who were formally diagnosed in a clinical setting.
Correct.
Right? Think about how many people do not attend, not just therapy for their narcissism, but just don't ever go see a professional. It's sort of like, the difference between how many people have high blood pressure and how many people have the